So thank you, Dr. Viehover. Our next speaker, we're going to hear from the European group, Dr. Giovanna Zorzi from Milan, who will be telling us about the European Natural History Study and the search for novel biomarkers in GNAO1. So welcome, Dr. Zorzi.
Jet lag. Okay, so thanks very much. So first of all, let me thank the Bow Foundation, because really it's really important to be researchers and family here meeting together. Is something that is really, really helpful, especially for the clinicians. So I would like to talk about our project that has been just started about the European Natural History Study and search for novel biomarkers in GNAO1 associated disorder. And before, I just want to spend a few words about what is the European Joint Program on Rare Disease. This is a program from the European community that is aimed to help research on a rare disease. And actually, it brings together institutions from many countries, European and also outside Europe. And since 2019, there has been these annual calls for funding projects. And actually, the last one was in 2033. There has been something like 80 projects. 27 were selected for a full proposal, and 13, including ours, has been funded by the European committees. So our project has just started on 1st of June. It will last 3 months, and it brings together many countries, European and extra-European, on this research about the natural history. So the previous speakers explained the reason why we need a registry for research on rare disease. It's always obvious, but GNAO1 is a rare disorder. We know that there are many phenotypes. There are many questions that we cannot answer about the progression of the disease, symptoms, response to treatment. So the aim of the registry is really to bring together a lot of patients and actually trying to look more precisely into the disease course. The problem is that if you want to look into symptoms, we need to measure the symptoms. So the natural history studies are built with the aim to use clinical scales to measure the symptoms. And this is, as we heard, a problem because there is no perfect scales. And one possible aim is to use scales that are already there, but also to create new scales that can be really specific to measure symptoms for that disorder. So the project is made by partners that have been funded from the European Committee, and you see many of the researchers are here in the room. So Italy, Switzerland, France, Israel, Germany, and Turkey are the principal partner. But we will be able to collect also collaborators, which means people from other countries that accepted to participate to the study even if they didn't get any funding. And so there are some other sites in Italy, there are Amsterdam, there is Croatia, there is Spain. So actually we were able also to, and this was a major contribution from the Patients National Association, from Spain, from the Netherlands, and from Italy, who really helped a lot. And actually I have to say that they were the promoter of this project. So very briefly, the project has two main parts. There is the clinical part, which is aimed to get insights on the natural history, that is aimed to create a registry. and also that is aimed to get insights about the brain imaging. And then there is a second part, more basic, which is aimed to find biomarkers. What is biomarker? Biomarker can be a substance that we can find in, I don't know, plasma, urine, or CSF that hopefully will help us to characterize the disorder and to measure the progression and the response to treatment. If we are able to find a biomarker, we are able also to see if, a drug treatment, for example, or another can be helpful. So biomarkers are really essential. We hope to find a biomarker to characterize the disorder. So we are planning to enroll, so our ideally is to enroll something like 100 patients. We know that this is very high purpose, but I think realistic we will be able to enroll something between 60, 70, 80 patients, which is a lot for a rare disorder. The first part of the project is the natural history study. So we want to assess once a year for 3 years every patient with a lot of scales, aiming to get insights into the movement disorder, epilepsy, sleep, nutrition, quality of life. So a lot of aspects. There are cognitions, a lot of aspects that can give us a picture more with quantitative assessment. The second aim, which I think is very important, is to build up a registry. So, and Germany and Moritz Thiel is in charge of this. We will build a registry in which all this information will be there. And hopefully this registry will then be kept even after the end of the project in order to continue to get data from these patients. The third aim is to look more precisely into the brain MRI. It means that patients will undergo MRI, and these images will be then analyzed with the aim to see if there are some statistically significant difference in brain volume, in brain volumes of some particular region. And this, of course, will help us also, for example, for DBS and to improve the targeting for these surgical procedures. But what is really interesting is the part 2, the basic research project with the aim to find the biomarker. And we decided to have some different approach. So, for example, you see in the work page Z5, this is what we say add-on target approach. It means that we want to collect, if possible, some CSF from patients. This CSF will be analyzed for the search for any substance. So this is what we call untargeted. There is no hypothesis. We want to measure this CSF substance and compare with the CSF control and see if we can find some particular substances that are in the GNAO1 patient. But also we decided to have a different approach, and a different approach looking for neuroinflammation in plasma of patients. Why this? First, because we know from clinical experience that GNAO1 patients are very sensitive to infections. You all know that infections can be the cause of dyskinetic crisis. You all know that when a child has infection, the clinical state worse. So we want to know if there is a biological reason for that. And it means that we will collect plasma, and in this plasma we will measure a lot of substances that are involved in neuroinflammation. The second reason why we choose this is because we know from the research that the gene is not only involved in signaling and the CMP process, but also in the immune response. So we want to see if with this approach we are able to find something. The second approach for the look of biomarker is to look at the microbiota. This is something that also the idea comes because unexpectedly the gene is very expressed not only in the brain but also in the gut. Okay, and there must be a reason for this. And also we know that in many neurodegenerative disease, a change in the microbiome is something that we see and is able to follow the progression of the disease. This part will be taken by Vladimir, so if you have a specific question, you can answer this. So this is the, another approach able to see if we are able to find something. I'm also finished because I just want to say two more things. First, I want to stress again the role of the Patients Association in our project, because really they did most of the work, and the Patients Association are always there to remind us that time is important and we really need to accelerate research in order to find answers. This is not easy. We know that we cannot predict the time, but I think if we are all here is basically because of the Patients Association. And just one last slide. For our Italian Patient Association, we are able to provide a Fulbright scholarship for one researcher who can come to America from Italy and work on GNAO1. Fulbright is a very important scholarship, and thanks to our PAO, we are able to provide this for a young researcher. So thank you very much.
Wonderful. Thank you, Dr. Zorzi. I, for one, am wishing we could fast forward 4 years so I could hear all the results of your study already. It sounds so exciting. For families that are listening, can you talk a little bit about your recruitment process and how can families get involved in that aspect?
So you see the list of the numbers of the recruitment are based on the patients that every center has already in charge. Okay, so personally we are following some 10 to 15 patients, Rome and Spain and Germany. We have new diagnosis, and we have recently very new diagnosis, and the Patients Association will help us to recruit those patients and to ask them to participate to the project. I have to say that I found that all the families are really willing to participate. First, because this is a very clinical project. I mean, patients are normally seen by specialists for evaluating of the clinical status, so it's just a more accurate clinical evaluation, so it's nothing that is really different from the clinical practice. We normally do EEG, we normally do MRI, so actually this is something that belongs to the normal clinical practice. So I don't think the enrollment will be very difficult. It's true that all this test takes some time, but I think it's a good opportunity also for us, the clinicians, to observe more carefully the patients. You know, that normally we have no time, we don't do all these scales every time, but we are forced to do that because of the project. And also let me thank all these partners that some of them are here. They accepted to participate without funding, because this is something that is very important. And I also especially thank Dario and Laura, because this is something that is very generous. We got funding, so it's easy for us, but all these partners will accept to participate just, for the scientific purpose. So thank you.
Any burning questions from the audience or anything online?